Hello everyone! Have you ever wondered how nurses help patients improve their health and be able to assist healthcare providers in treating patients? Do they have a guide as they perform well in the professional field? I'll tell you how. It is through the application of nursing process. Even as student nurses, you too can make a difference on improving the patient's health condition with the use of nursing process. Once again, this is Dr. Judith Sugay, Fundamentals of Nursing lecturer. Join me as I discuss the nursing process, particularly the assessment phase. For the learning outcomes, after completing this module, the students will be able to understand the overview of a nursing process, enumerate the components of nursing process, define assessment as one of the components of nursing process, and explain the methods of data collection. Nursing process is a deliberate activity of nursing practice done in a systematic manner. The nurse uses a comprehensive knowledge base to assess the client's health status, make judgments and diagnoses, plan, implement, and evaluate the effectiveness of appropriate nursing actions. Here are the purposes of nursing process. First, it provides a systematic methodology for nursing practice. It defines the nurse's role and function and enhances collaboration among healthcare team. Third is that its emphasis of care is focused on health promotion, maintenance and restoration of health, or peaceful death, depending on the client's condition. The following are the characteristics of a nursing process. First, it is goal-directed and toward client-centered healthcare. Second, it is systematic and provides an organized approach to nursing. Third, it is dynamic by focusing on the changing responses of the client during the ongoing process. Fourth, it is applicable to individuals, families, and community groups at any level of health. Fifth, it is adaptable to any practice setting or specialization, and the components may be used subsequently or concurrently. Sixth, it is personal and based on the client, nurse-client relationship. Seventh, it is useful with any type of model, especially nursing. Here are the components or phases of nursing process. First, we have assessment. Okay, assessment is an ongoing process of data collection to be able to determine the client's health strength and other health concern. Diagnosis, on the other hand, is the analysis and synthesis of data to be able to identify patterns and compare with norms, standards, and models. A clear and concise statement of client's health status or concern is necessary to be able to determine the appropriate nursing intervention. Planning, on the other hand, involves determining how to assist the client in resolving concerns related to restoration or resolving health concerns. It also includes the development of goals and objectives. Implementation. This involves carrying out of a plan of care by, of course, the nurse and be able to involve the client through the processing of health concerns. Evaluation is a systematic, continuous process of comparing the client's response with written goals and objectives of care. For the assessment, again, this component of nursing process is the foundation of nursing process. Accurate data collection leads to identification of the client's health status, strengths, and concerns for the nursing diagnosis. The purpose of assessment is to be able to identify and obtain pertinent data about the client. So here are the phases of assessment. So the first one is to gather preliminary information during the initial interview with the client. So here, take note of the demographic information about the client. So these are name, address, age, date of birth, place of birth, gender, ethnic group, religion, primary language spoken, civil status, health educational, highest educational attainment, and occupation, income, health insurance. This database helps the nurse understand the client's perception of health, what factors influence the client's health, and what nursing intervention is necessary to facilitate the client's achievement of optimum health. Phase 2 involves determining the appropriate model to use for data collection. So here we're going to use Gordon's. Okay, Gordon's present an eclectic multifocal model for data collection, and it is based on the 11 functional health patterns. So let's focus more on the next slide about the 11 functional health patterns. Gordon's 11 functional health patterns. First, health perception or health management. Second, nutritional or metabolic. Third, elimination. Fourth, activity rest. Fifth, cognitive perceptual. Sixth, sleep and rest pattern. 7, self-perception or self-concept pattern. 8, role relationship pattern. 9, sexuality or reproductive pattern. 10, coping stress tolerance pattern. And value belief pattern. Phase 3 is to determine the need for focused or general assessment of the client's health status. So, if the client expressed a specific health concern related to pain during the preliminary information phase, the nurse then focuses on determining the exact nature of that concern first. Using the chosen model, the nurse determines the nature and scope of any additional information that is needed to facilitate the identification of concerns and strengths within the context of the situation. So, data are collected by means of these three methods. These are interaction, observation, and measurement, or we have IOM. Interaction data are obtained by means of relevant verbal communication with the client, healthcare personnel, or significant others. Interaction data are obtained through effective communication and interviewing skills. The outcome of interaction is data that reflect what the client said. Okay? And interaction data are considered as subjective cues. Take note as well that statements by the client should be noted as direct quotations rather than paraphrasing what the client said. Again, this prevents the probability of placing one's own meaning of data. Let's have here comparison of accurate interaction data versus the nurse's personal interpretation of the data. So for accurate interaction data, we have quote-unquote, the client said, "I'd rather be left alone now." For personal interpretation, it's noted as client is angry. Another one for accurate interaction with direct quotation, quote-unquote, "I feel like I've gained weight." And for the personal interpretation, as you can see, it says here, client is fat. So see the difference? Next method of data collection is observation. Observation data are gathered by means of the senses such as sight, touch, hearing, smell, and taste. This includes written documents as well. Observation data, characteristics of appearance and function. Okay, so when you say sight, again, you observe for color, posture, balance, data from nurse's notes. Okay, so you have to see this one. For touch, you take note of course, warmth. There could also be texture, moisture, muscle tone. For smell or taste, foul odor, chemicals in the air. How about for hearing? Take note, of course, of the auscultation of the heart, bowel sounds, ability to speak. For the content, okay, for sense of sight, we have here nonverbal communications such as gestures, body movement, eye contact. But for touch, content is not actually applicable. For the smell and taste, you take note of the odor. For the odor of the room, home, environment, odor of the food. Okay. And for hearing, take note of the amount of interaction with the others, tone of voice, specific word mentioned. And here we have observation data as to the environment. Again, for the sight, take note of the client's room, its cleanliness, neighborhood. For the touch, take note of the temperature. So we have, of course, example, air, humidity. For smell or taste, you have the odor of room, home, environment, food. These are examples. Hearing, usual sounds, okay, that you can hear at home or in the community. How about measurement data? Measurement data are obtained by means of instruments that can quantify information. So, measurement is used to ascertain the extent, dimension, rate, rhythm, quantity, or size, frequently using instruments in addition to senses. Examples of data that can be measured, also considered as objective cues in the nursing process, could be laboratory tests, vital signs. So again, measurement is necessary than personal interpretation. So, only after data are clustered, validated, and analyzed that you should make an inference, okay? So, let's have here an example of accurate measurement data versus one's personal interpretation. As I've mentioned to you a while ago, accurate measurement is necessary than providing personal interpretation, okay? So, for example here, alcohol intake per day is 1 liter of rum. Personal interpretation, which is a no-no, drinks a lot of alcohol every day. So again, take note of the unit of a measurement here. So again, only after data are clustered, validated, and analyzed, okay, that you should be able to create inferences, okay? Next is documenting data. Okay, so for documentation, okay, we have to record the interaction, observation, and measurement. We make sure that we cluster them. When we say cluster, you group them in accordance to its relevance, okay, and relationship perhaps. and then placed in the first column of the nursing care plan. So, this is the nursing care plan. It actually has 7 columns. The health assessment is reflected in the first column, okay? And it includes or reflects the subjective cues and objective cues, okay? So, again, for the subjective cues, you have the interaction, all right? This is the what the client told you, okay? Objective cues, on the other hand, includes both observation and measurement, okay? And on the next column, we have nursing diagnosis. So nursing diagnosis reflects the health condition of the client based on the NANDA, okay? And then third column is the analysis. This explains the nursing diagnosis, okay? Then the next one is goal and objectives. So here, you assist the client in resolving health concerns. Development of goals and objectives as well is included in this column. And then the next one is intervention. This is where you carry out the plan of care, okay? And then, again, interventions are based on the objectives that you have formulated here, okay, in this column. And then, after intervention, you have rationale. Rationale reflects the significance of each nursing intervention. And then finally, for the 7th column, you have the evaluation. This is a systematic, continuous process of comparing the client's response with the written goals or goal and objectives. So, here are the references that I have used. And once again, if you have questions, please let me know during our synchronous class. And thank you for listening.